Well, a scar on their face or a pigmented birthmark can make a child really self-conscious or even cause others to bully them. Dr. John Girotto is part of a team of doctors at Helen DeVos Children's Hospital who is here to talk more with us about the impact of bullying and, of course, how his team can actually help everybody else. Good morning to you.
Good morning. Thanks for having us.
Absolutely. And bullying has definitely changed over the years. You know, I think social media plays a role in that. But what kind of statistics are out there that really are eye-opening?
Well, I think you bring up, first and foremost, a very important point. The CDC would tell you that 30% of children in high school will experience some form of bullying over their high school years. You know, when you and I were in high school, we worry about fights on the playground. Right. But now in the selfie age or the social media age, bullying can continue on your cell phone 24/7. It follows you home and it follows you on vacation.
Wow. All right. So this is something, of course, that comes from maybe having a physical problem that leads to a mental problem for a child, and your team, as we mentioned, is there to help. What you guys do isn't necessarily cosmetic surgery. You said that really doesn't exist for children.
I think your appearance and your outward intake, peer response, is very important in your overall psychosocial development, especially at a young age. Sure. We all remember how junior high school was, how high school was in particular, but it's really whole patient care. So I always say it's not cosmetic surgery for kids. Our team involves a psychologist as well as a dietitian and our healthy weight loss program, as well as the roles of endocrinologists in our team, as well as our hematologists. It's really a comprehensive whole patient care.
What comes along with weight gain that might get a child teased?
Well, many different aspects, but weight gain, peripheral fat, also leads to the production of estrogen, both in boys and girls, and peripheral estrogen leads to breast development. So in girls, that can be overly large breasts, or in boys, the production of breasts as well. And the team approach to that involves weight loss, as well as oncologic evaluation to make sure it's not caused by a tumor before we even come around to see the surgeon.
Are you surprised sometimes how long it takes for a parent to actually step forward knowing their child has been bullied because maybe they think they can resolve it on their own?
Or they don't even know it happens.
Sure.
My daughter's 14, and we have to look through her cell phone every once in a while. You're not allowed to have a password to your cell phone that I can't help access, so I know what's going on in your life as well.
Right.
I think some of that exists in a world where parents don't even know.
I mean, there's that saying out there, we should definitely love who we are. I guess what would you say to somebody that says that it's not as easy for everyone to accept?
Absolutely. You know, God loves wondrous variety, right? Many people have written on both sides of that discussion, and the opinions are fairly split down the middle. But I would tell you that there's many things we do every morning. We get up, we style our hair, gel, makeup, we choose the clothes we wear very specifically because outward appearances impact how we're perceived in society and how our social development goes forward. I think it's a very important component.
Absolutely. You guys take a multi-specialty approach. Walk us through the steps of that, if you wouldn't mind.
Well, it depends what your diagnosis is or your concern when you come in. But the DeVos Children's Hospital, Helen DeVos Children's Hospital, has excellent medical specialties in pretty much all areas of subspecialty care. So as I was alluding to, for a vascular malformation or a red birthmark that you can be born with, that involves our dermatologists, it involves our plastic surgeons. Because it's a blood vessel problem, it also involves our hematologic team, so all the way down the line, and of course our psychology group as well.
And then the end result is a kid that walks away and has a better self-esteem.
A new sense of self-confidence and can function better in society.
All right, great advice. All right, so if you have a child at home and maybe this speaks to you, make sure to contact them. The Pediatric Plastic and Craniofacial Surgery is located at 426 Michigan Street Northeast, Suite 304, which is in Grand Rapids, or give them a call at 616-486-5885. Check them out online, as always, at helendevoschildrens.org/plastic surgery. Thanks for stopping by. Have a good one.
Thank you.
Absolutely.